David.
What going Nikisha? Long time.
Yeah, my friend, long time you not hear from you, so.
Yes.
So for 2 days now, you see, I
Uh-huh.
have a high fever. And you see
High
right,
fever?
yes, and you see right at them 2 places here, so them would have killed me. It's painful. Right now, me I talk to you, you know, no pain me I feel me while me I talk to you.
That not so good, man. That not so good.
You know,
So hold on. You know, link up Google. We find out how do you.
You know, so understand them something there, man, about Google. You know, so understand, and then furthermore, me no want to go over hospital neither, because this whole COVID thing over there, me no want to go over there, David.
Stop worry yourself, man. Stop worry yourself. Everything going to be all right.
I don't like how me feel.
Well, you're trying, you know, because me heart too weak for that right now. But hold on. Let me link up Google and so where you depend.
All right.
Stop. Ease up with the tears, man. Everything is going to be all right. All right. Guess what?
I feel like I lost on me.
Boy, wipe off your mouth and talk something good. Answer that. All right. All right. This is what Google has say. Based on this, what you just tell me, say it has something like a tonsillitis, which means the information of the tonsils. And you know, say tonsils, based on what you tell me, say they back of your throat, so. But guess what? Me know one student nurse, one of my friend, you know. So me go send her a link there to you, so you can call her and link her up, because she will give you a better professional answer on that more than me.
All right. I hope you know, but I can't tell me about governor hospital. Anyway, thank you. This is Nikisha. You know, your friend David gave me your number to call you.
Yes, Ms. Brooks. So I did receive the call from David, and it seems to me that you have an issue within your lymphatic system. So basically, the lymphatic system is an intricate vital organ system in the body. It's along with the blood system, are the body's two main circulatory systems. So the lymphatic system assists three other systems in the body, that is the digestive system, the immune system, and the blood system. It assists the blood system by transporting or returning extra fluid back to the blood system. It assists the immune system in fighting infection. And finally, it also assists the digestive system in transporting large molecules, for example, fats.
Kind of understand what you say, but even tell me something about tonsillitis. What is that?
So basically, tonsillitis is the inflammation of the tonsils, and tonsils are basically lymphatic tissue clusters just below the mucous membranes that line the mouth and the throat. So there are three types of tonsils. You have the lingual tonsils, the adenoids, also called the pharyngeal tonsils, the palatine tonsils, also called the tonsilla palatina. So the lingual tonsils are located at the most posterior part of the tongue base. The adenoids are located at the uppermost portion of the nasopharynx, and the palatine tonsils are located between the palatoglossal arc anteriorly and the palatopharyngeal arc posteriorly.
I understand exactly what you're saying. All right, nurse, thank you very much. Thank you.
Okay, no problem, Ms. Brooks. So I have a friend who is a registered nurse at the Mandip Regional Hospital. I will transfer your number to her and have her give you a call, okay, just to explain the situation further. Okay, thank you for calling. Bye-bye.
Nurse Morgan.
Yes, ma'am.
How are you today?
I'm fine, and you?
I'm not okay. Nurse, right now, I'm stressed out. I'm sick, you see, I'm sick. Right now, right at them 2 places here, under my throat, I can hardly touch it. When me do so, I can actually feel it swell, and me have a piece of fever, and me don't know, I can hardly swallow. Lord, nurse is stressing, and nurse, me don't really want to go over hospital, because me don't like the hospital system, you know. I feel like I lost, me nurse, please.
Oh, don't worry, ma'am, don't worry. Please don't cry. Actually, there's just a few things that might be wrong. Lymphadenopathy, that's an infection that causes the lymph nodes to swell. So things like HIV infection or like wounds on the skin that were infected, these can cause lymphadenopathy, right? It might be painful, the lymph node that's swollen, or it might cause a fever or skin rash.
I never HIV, you see, a while ago.
No, I'm not saying you have HIV, miss. I'm just saying that it can cause it. Another one would be lymphedema. That is caused by a blockage of scar tissue in the lymph nodes or vessels. That's commonly seen in patients that are doing cancer radiation treatments.
Say it again, cancer. Oh God. She
But
understand.
no, you won't die, man. The
Oh,
last,
God.
oh, that's lymphoma. That's basically cancer of the lymph nodes. Hopefully that's not what you have. This is,
So you said this when you call it under me throat here, so we swell up now.
yes.
Oh, Jesus. All right, nurse, let me see you. Even though I want your way, I say, but continue.
So the lymphoma is a cancer of the lymph nodes. This is caused by lymphocytes that are developing and multiplying uncontrollably. So if you have any fevers, chills, headaches, weight loss of appetite, though since I'm only a nurse, a registered nurse, I cannot give you a proper diagnosis. So I'll refer you to someone else to give you diagnosis and treatment.
All right, as long as me I go get little help. But me not like the sound of this. This not sound right. Me not ask Christ.
Don't worry, I'm sure it's nothing to worry about. So I'll send you the referrals and the contact information.
All right, nurse, thanks for your information.
Okay, you're welcome.
Hello, Miss Brooks. How are you doing today?
Why, doctor, I'm not doing so well.
What's happened to you?
Doctor, tell you the truth, I don't even know because of the first in my life me ever feel so. Doctor, see right under my throat here, so and me tender and painful, pure pain, and I have a piece of high fever. 2 nights no me no sleep, doctor, because of the pain, and when me swallow, we can hardly swallow. Pure pain, and I can hardly even talk. When me talk, it's so painful, doctor. Me I realize that my skin look rash up like, doctor. So me don't know, doctor. I don't know. The nurse tell me you're good. So me glad me get a chance to talk to you, doctor.
Okay, Miss Brooks. So, all right, based on what you're saying and what I've heard from Nurse Morgan, I'll need to do a quick, just a little examination. So I just want you to raise your head to one side for me so that I can see where you're having. Okay,
Oh,
good. The other side now. All right, Miss Brooks.
painful, doctor. Oh God, doctor.
All right, no mind. Yes. So as I was saying, it really looks swollen to me, and it seems now that you're having some problems with your lymphatic system. And this system is very important because it plays a major role in your immune response. And your immune response is basically a system that helps to fight off or kill anything that is foreign to your body. So it protects you from viruses and bacteria, anything that will cause damage to you. Understand?
Yes, doctor, me kind of understand. Like I try to say, if anything like bacteria and so enter my body, that the system they would have help prevent it from just full up my body, then I make me sick.
Yes, exactly so, Miss Brooks. The lymphatic system also aids in homeostasis. So it removes excess fluids, and these fluids may contain bacteria, virus, or anything of that sort, along with antibodies and lymphocytes. Antibodies are what basically fights and kills the bacteria that are foreign or bad for your body, right? And your lymphocytes are your white blood cells. Understood?
Yes, doctor, me understand you. No wonder me feel so sick, doctor.
Yes, that explains it, right?
Okay.
All right, so like before I make my diagnosis, I'll need you to do some tests for me, okay? I want to set an appointment for you. So tell me when you'd like that appointment to be. When will you be able to go? As soon as possible.
Probably tomorrow, doctor.
All right, so let me set it up. All right, so you're good for tomorrow. Is 9 a.m. okay?
Yes, doctor, 9 a.m. is all right.
All right, good. So when you're going to do a blood test, so as soon as I have your results back, I'll call you and inform you and make my diagnosis as to exactly what is going on with you. Okay, Ms. Brooks? Until then, for the pain that you're feeling, you can try some over-the-counter medication like Panadol to see if it gives any ease, but I can't really recommend anything as yet until I have the diagnosis, okay?
Okay, doctor, all right. So I just buy the Panadol and just take it.
Yes, Ms. Brooks.
Oh.
All right. So when I get the results, as I just said, when I get the results from your test, I'll call you and inform you of the results, okay?
Okay, doctor, all right.
2 days later.
Hello, Miss Brooks. How are you doing today?
Hello, Dr. Chambers. Not feeling 100 at all, but I'm not so bad. I'm not worse.
Okay, okay. Hopefully you'll feel better with the medications I'm about to prescribe you. All right, so I did get your results. And according to what your results read for your blood test, your ultrasound, and the biopsy, you have what is called lymphadenopathy. Okay. Do you know what that is?
No, doctor. That sounds like something bad, doctor.
It's just like infection. And this infection can be caused due to cold, flu, or what is known as strep throat.
Yes, doctor.
So with that said, I will be prescribing you with some like antibiotics, and I'll send the prescription to the hospital pharmacy where you can pick it up, okay? And yes, for the antibiotics that I'll be prescribing you with, you need to take it on time, and you need to take all of it until it's completely finished, okay?
All right, doctor.
And along with that, I'll need to do a follow-up with you in 4 weeks' time.
No problem, no problem.
Until then, take care and have a good day.
Thank you, doctor. Thank you.
All right, bye, Miss Brooks. 5 lymphatic trunks in the body. You have the lumbar trunk, the jugular trunk, the bronchomediastinal trunk, the subclavian trunk, and the intestinal trunk. The lumbar trunk is the lower pair, and it drains lymphatic fluid from the leg, kidney, wall, and viscera of the pelvis, the abdominal wall, and the adrenal glands. The jugular pair is located in the neck, and it drains cervical lymph nodes of the neck and the head. The bronchomediastinal pair is located in the chest, and it drains lymphatic fluid from the lungs, the heart, the trachea, the mediastinal, and the mammary glands. The subclavian pair is located under the clavicle, and it drains apical nodes of the armpits. Finally, you have the intestinal trunk, and this is unpaired trunk, and it drains lymphatic fluid from the stomach, pancreas, the spleen, parts of the liver, and it drains chyle from the intestine, and chyle is lymphatic fluid mixed with fat. These 5 lymphatic trunks then drain into ducts, and there are 2 ducts. You have the thoracic duct and the right lymphatic duct.